Welcome back, beautiful people. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I am your host, Zen Sams. Now, I am live at Ocean Casino Resort right here in Atlantic City, sitting in Top Golf with breathtaking views. Now, Amy Kennedy is going to be joining me in just a few, and we're going to be chatting about the ongoing mental health disorder in America and coping with sending our children back to school in a healthy manner. Now, this is a serious issue, guys. About 1 in 5 adults suffer from a diagnosable mental illness in a given year. All right, that's 20%. And every day, approximately 123 Americans die by suicide. FYI, there's 1 death by suicide in the US every 12 minutes. 1 in 6 US youth aged 6 to 17 experience a mental health disorder each year. And 50% of all lifetime mental illness begins by age 14 and 75% by age 24. These are staggering numbers. Suicide is the second leading cause of death among people aged 10 to 34. So you are not alone. What I'm saying is that we are all suffering in one way or another. When you have 21% of US adults that experienced mental illness in 2012, that's scary. That's about 51.5 million people, which represents 1 in 5 adults. Now, joining me now, we have very good friend Amy Kennedy, Atlantic City, New Jersey's very own Amy Kennedy, and she is definitely not your average. She is a mom to the most incredible children, a lifelong partner to Patrick Kennedy. She's also an educator, a bright light, and one of the biggest mental health advocates out there. She is education director of the Kennedy Forum, where she and her husband Patrick are one of the world's leading voices on mental health and addiction. Welcome to the show, Amy.
Oh, Zen, thank you so much. I'm so glad to be here with you and that you are telling everybody how great it is here in Atlantic City.
Oh, Atlantic City is just one of those places where, you come and you feel like you're on vacation. And especially on a day like today, 9/11, where it was so tragic. The biggest tragedy occurred 20 years ago today. And what I've tried to do is throughout the day, give uplifting stories to my listeners. We've heard it go on and on for the last, 15 hours about 9/11. And now it's time to turn it to the next notch, right? This is very troubling. We have the Center for Disease Control and Prevention study found that between April and October of 2020, there was a 24% uptick in the proportion of mental health emergency visits for children ages 5 to 11 compared with the same time in 2019. Amy, tell me, how do we fix this?
I think it's important, as you mentioned, to think first about 9/11 and how that was a trauma for our society, for the people involved. And likewise, this has been a very traumatic time for so many people. And we have to not just ignore it and gloss over it, we need to address it. Just like as our doctors would give us a checkup each year, we need to think of a checkup from the neck up. What are we doing to look at our own mental health, to address it, whether it's with putting ourselves in a space like this where we can enjoy the outdoors, where we can be connected with friends and family that we've been so disconnected from over these past months, or whether it's by taking steps that maybe are a little bit more aggressive and seeking out help.
I can't begin to thank you enough for all the work that you're doing for advancing mental health research and really kind of diving face first into this. I mean, you and your husband are huge advocates. I recently read a report that the Colorado Children's Hospital back in May declared a mental health emergency. And in 2021, the national polls found that 46% of parents said their teens had shown signs of a new or worsening mental health condition since the pandemic. And now we have a once in a lifetime opportunity, Amy, to create a national roadmap for mental health support and for our young people. Please share the vision that you have put in front of, Congress here, because you are fighting and paving the way.
That's right. We do have an opportunity because there is new funding that has come as part of the rescue plan that we could make sure that all schools are addressing this. It isn't just those who are in crisis, but what are we doing for prevention, early intervention, and how do we just enhance our resiliency? So, for all of our children, we could be doing very basic things on a tier one level to encourage social emotional learning, mental health literacy. We need to push our school boards to make sure that they have adopted a systematic approach with multiple tiers so that students at the very basic level can get enhancement and can perform at their highest potential. But those that are in crisis also have supports in place so that if they move through the system, we know that it's not going to be every student every day, and that they may move through this as a temporary difficulty or struggle, but that they'll have what they need in a place where they're spending so much time, because we know there is no learning that's going to happen when they're struggling with their mental health. So to integrate that into schools, we could be doing things like having partnerships with our healthcare system. We could do screenings as you're doing in New York City. That is a simple checklist, a questionnaire, 5-minute questionnaire to show signs early and make sure kids are getting some interventions. That could be very simple. And we can also do things to make sure that the curriculum is in place or that telemental health services are reimbursed right at school.
That's a great point. And with the crisis that's ongoing, we know that schools are a good place to start, and educating the child is not just about reading, writing, and arithmetic. As we know, good social emotional skills and good mental health are totally essential for a productive and healthy life in general. So we know now that the NYC and New Jersey schools are expanding their mental health support for their students. This pandemic has left our kids really in crisis, Amy, like you said, and our babies are suffering. And we need to think about mental health as part of returning to school, like you said. Now, in New York City, which is the nation's largest school district, our education leaders are responding proactively, and I'm happy to see that. But they're offering this historic expansion of services, so to speak, for young people and families, which I think is great. And starting this fall in NYC, they're going to be providing universal-based screening from kindergarten through the 12th grade to identify students who are distressed and have experienced trauma and, a slew of other mental health needs. So I'm really excited that they have rolled this out. And I know that you have a lot to do with programs of this nature, and that you are working diligently with Patrick to get funding for some of these very well needed programs, especially here in New Jersey. Can you tell me a little bit more about the plan that you have proposed? Because I know that it's very, very well thought out, and it's not your average. I mean, you're thinking 5 steps ahead here. Please fill us in.
Well, I just want to make it really clear to your listeners that it is not just about having more mental health professionals in the school, right? Just like employers are thinking about mental health in a way that helps build out the capacity of their workforce, schools are thinking like that too. How do we help our students to be the most successful so that they're making good decisions, so that they're able to be focused in class? And that's going to take some screening so that we can intervene early. It means that we have to build out an infrastructure to support students, because what we're actually seeing is that when we don't do the small steps early, we see kids, young adults, waiting in emergency rooms. As you mentioned, that state of emergency out in Colorado was because the emergency rooms were overrun with students in crisis. We don't want to see that happen. So we've got to put in place the things that can help intervene and can be a stepped level of progress for those that are struggling. And if we build that infrastructure, it means that we're supporting things like 988, which has already been passed, that we have not only the telemental health, but patient beds, if they're needed in psychiatric hospitals, that we're able to do the licensed clinical social workers in schools, that we're able to have those supports to ramp up our efforts for more trained professionals. And that's everybody from your children's coaches and the crossing guards and the people working in the libraries, everybody that's coming in contact with young people so that they'll know the signs and be able to refer for help.
That's excellent. And that makes me feel, better as a parent, knowing that we're sending our children back into an environment and where all of their needs are tended to, not just, the academics. Now, was it you, Amy, that told me about the American Rescue Plan? Because I read that the American Rescue Plan, and perhaps I read it maybe in your article or one of the other mental health articles, but they're providing 130 billion in funding for schools reopening and including 2.7 billion for New Jersey. Now, these investments are great. They're a great start, but the funds are only a short-term, partial solution, so to speak, for a long-term problem that, in my opinion, is going to continue well after the immediate public emergency, right? So the money New Jersey received is designated to be used, per this U.S. Department of Education to safely reopen schools. But how is it that they are going to be able to really kind of nip this in the bud without this spearheading out of control? I mean, to a certain level, we also as parents have to take control at home and not just at school. Would that be accurate?
That's a big question. We want to see this money go to evidence-based practices. So the fact that it's only available for the next 3 years means that we need to put in some sustainable funding. We need to reimagine what schools look like so that we really do address students' brains. We're not just trying to pump in facts and figures. We're talking about how do we best learn? How do we make productive decisions in our lives? How can we interact socially and emotionally so that we'll be successful? And in doing that, we can bring a change to the way we've done education. We can think about how we can improve the funding streams to put in place not only those mental health professionals, but different curriculum that's going to enhance student learning and make sure that whether it's having Medicaid reimbursed for students who don't have IEPs, we know that every student that needs services, it doesn't necessarily have an IEP, that we're able to put that in the school system where they can find the help during the school day, because it's difficult for parents after school to be able to find a provider and get their child where they need them to go. But if it's just baked in and it takes some of the stigma out of seeking these services, just like going to the school nurse would.
Yeah, exactly. I mean, this is heavy stuff, and these are not things that we as parents were even, emotionally ready or equipped to deal with, let alone what the pandemic did to us. But now sending our children back to school, and like you said, wanting to send them in an environment that is an educated environment where we know that these professionals that are tending to our children have gone through a certain process, certification. Everybody dealing with these children has to be of emotional sound, so to speak, and they can't bring their baggage to school because they themselves may be facing an emotional issue. So I think that this plan is great, and I hope it's not limited to just the 3 years. I really hope that this is going to be something that we implement long term, because the ongoing mental health disorder in America, it didn't just come out of nowhere. This is an ongoing health issue. I think it's just been accentuated by the pandemic. So thank you for shedding some light on this topic, Amy. It's always great to speak to you.
Thank you so much. And I hope you'll take a look at the Hopeful Futures campaign that we're doing with Inseparable so that you can look for how to promote this in your own community.
Oh, without a doubt. And for those of you that don't know Amy Kennedy, you guys definitely have to check her out. A simple Google search will do it. Or you can check out the kennedyforum.org, where Amy is very vocal. Her articles are great. She's always at the top of the pulse of everything going on in mental health, and how the advocacy programs are trickling directly into the public that you are so desperately advocating for. So thank you, Amy. I truly appreciate it. We are live at Ocean Casino Resort at Topgolf. You're listening to A Moment of Zen right here on 710 WR, the voice of New York. I'm your host, Zen Sams. We'll be right back after this.